Chapter 1: Strategic Human Resources Management based on Human Resources in Healthcare. Managing for Success, 5th edition by Carla Sampson and Myron Fottler. In today's healthcare organizations, people are the strategy. Unlike products that can be stored or shipped, healthcare services depend on human interaction. A nurse comforting a patient, a physician diagnosing a complex case, or a technician ensuring accurate test results. Every service, every outcome, and every patient experience begins and ends with people. That's why Strategic Human Resources Management, or SHRM, is more than just hiring and payroll. It's about aligning people, culture, and performance with the mission of care. Introduction and core concepts. Let's begin with the basics. Human resources, or HR, refers to all the people who currently contribute to the organization's mission, those who may contribute in the future, and even those who have contributed in the recent past. In healthcare, this includes physicians, nurses, technicians, administrators, and every individual who helps deliver care. Strategic Human Resources Management (HRM) goes a step further. It is the process of formulating and implementing HR strategies that reinforce the organization's business objectives and support innovation. In essence, SHRM connects workforce planning, performance management, and organizational goals into one unified system. Healthcare is a labor intensive industry, meaning production and consumption happen simultaneously. Care cannot be stored for later use. Because of this, success in healthcare depends heavily on achieving the Quadruple Aim: enhancing patient experience, improving population health, reducing costs, and ensuring the well being of healthcare providers. Organizations like Mayo Clinic and Cleveland Clinic exemplify this by investing in people centered HR strategies that align with their mission to deliver safe, efficient, and compassionate care. Rationale for SHRM and its link to performance. Why does strategic HRM matter so much for healthcare executives? Because no strategy, whether it's patient satisfaction, quality improvement, or cost containment, can succeed without the right people in the right roles. Understanding HR functions is not optional for executives, it's essential. Tasks such as staffing, job design, training, performance improvement, and employee engagement shape an organization's ability to achieve its goals. Through SHRM, organizations can gain competitive advantage in three primary ways: cost leadership by improving efficiency and reducing turnover, product or service differentiation by enhancing the quality of care and patient experience, value creation through a motivated, competent, and committed workforce. For example, Kaiser Permanente uses data driven HR practices to reduce employee burnout and increase productivity, aligning workforce satisfaction with organizational outcomes. Evidence linking HRM and organizational success. Research consistently shows that effective HRM practices like employee participation, transparent communication, and fair appraisals directly improve productivity, patient safety, and financial performance. This relationship is sometimes described as the black box phenomenon. It refers to the hidden mechanism that connects HR practices to performance outcomes. The black box lies in how employees' competence, commitment, and motivation translate into measurable organizational success. The challenge for HR leaders is to make this connection visible through metrics, engagement data, and continuous improvement. Effective HR practices for healthcare organizations. Now let's explore what effective HR practices look like in healthcare settings. The textbook highlights several evidence based strategies that drive high performance. First is HR planning and job analysis. This involves identifying future workforce needs, encouraging teamwork, and developing work life balance programs. Organizations like Johns Hopkins Medicine use predictive analytics to plan workforce needs years in advance, ensuring staffing stability in critical departments. Second is staffing. Proactive recruitment and selection are essential. Healthcare organizations must attract candidates who align with their mission and culture, not just those with technical skills. For example, Cleveland Clinic's Patients First philosophy guides their recruitment process to ensure every new hire embodies empathy and service excellence. Third is performance management and compensation. Reward systems should include both monetary and non-monetary incentives. Linking pay to team-based performance fosters collaboration rather than competition. Intermountain Healthcare, for instance, ties physician bonuses to quality outcomes and patient satisfaction, reinforcing alignment with the organization's strategy. Fourth is employee engagement. Effective communication, transparency, and involvement in decision making increase engagement and trust. When employees understand how their work impacts the organization's mission, they feel empowered and valued. Fifth is diversity, inclusion, and belonging. In today's healthcare environment, diversity is not a checkbox, it's a strategic necessity. Building inclusive cultures fosters innovation, reduces bias, and enhances cultural competence in patient care. For example, Mass General Brigham has implemented diversity councils to address equity and belonging at every organizational level. Finally, employee well being. Promoting a positive work environment, monitoring burnout, and supporting resilience are vital. Programs like Stanford's WellMD initiative show that physician well being directly influences patient safety and organizational performance. Together, these practices form the foundation of high performance work practices, HPWPs, systems that link employee success to organizational excellence. Environmental trends affecting HHM. The healthcare environment is evolving rapidly, and HR strategies must adapt. Major healthcare trends include changes in reimbursement models emphasizing value based care, emergence of new competitors such as retail clinics and telehealth providers, rapid advances in technology and data analytics, a growing shift toward outpatient and community based services, persistent pressure to reduce costs while improving quality. Broader HRM trends include global competition for skilled workers, increasing use of digital platforms for recruitment and engagement, rising cybersecurity concerns and data protection issues, an aging workforce coupled with greater generational diversity, expanded reliance on HR analytics to make evidence based decisions. Key challenges for HR leaders: retaining high performers, developing future leaders, managing burnout, and creating a culture of trust and fairness. Progressive organizations are responding with flexible work arrangements, career development programs, and comprehensive total reward systems that promote loyalty and engagement. For instance, Mount Sinai Health System in New York introduced hybrid work models for administrative teams and data analytics roles, improving retention while maintaining efficiency. The Strategic Human Resources Management Model, Exhibit 1.4. Finally, let's look at the SHRM model, which outlines how HR strategy connects to organizational success. The model involves several core process steps. First, assessing the environment and mission. Second, formulating the organization's business strategy. Third, identifying HR requirements. Fourth, comparing the current HR inventory to future needs. Fifth, developing an HR strategy to close the gaps. Sixth, implementing HR practices that reinforce the overall business strategy. In other words, SHRM ensures that HR functions such as recruitment, development, and rewards are not isolated activities but strategic levers that help achieve competitive advantage. When this alignment is achieved, organizations move from reactive HR management to proactive strategic leadership. A good example is Mayo Clinic, where HR strategy is embedded within every departmental goal. Their leadership development and recognition programs are directly linked to clinical quality and patient experience metrics. We've now covered the foundation of strategic human resources management, its definitions, rationale, effective practices, environmental influences, and the SHRM model that ties it all together. In part 2, we'll now explore how SHRM is implemented, how outcomes are measured, and how HR leaders build lasting competitive advantage through people. This video is based on Chapter 1, Strategic Human Resources Management, Human Resources in Healthcare.